diet plays a crucial role in the management of the irritable bowel syndrome. Dear colleagues, with dietary changes often being more effective than medications, I'm happy to have raised your interest in this topic. I will address in this first part of my presentation the why, and later on the which and the what of dietary treatment of IBS. Starting with the why, we will have first a short repetition of carbohydrate digestion, followed by addressing the role of carbohydrates for IBS symptoms, talking about healthy nutrition and dietary fibers, about FODMAP, about lactose intolerance, and about the hypomorphic variants of human carbohydrate active enzymes. And lastly, the treatment approaches. Should it be a dietary shotgun approach or a precision knife approach? And I want to raise your interest and about these terms, which we will later discuss. And we will talk about why and how to identify intolerances. Let us spend a little time on a short repetition of carbohydrate digestion in the human small intestine. Carbohydrates ingested, be it as disaccharides, as oligosaccharides, as polysaccharides, need to be digested down to their monosaccharide components in order for them to be absorbable in the small bowel. And for this purpose, we have a number of carbohydrate digestive enzymes, starting with salivary amylase in the mouth, followed by pancreatic amylase, and finally, the membrane-bound disaccharidases, maltase, lactase, trehalase, sucrase in the small intestine. Please be reminded that 84% of adults with IBS reported gut symptoms related to at least one food, and with increasing severity of IBS, the number of food items having been reported also increases. The common denominator of many of these foods is incompletely absorbed carbohydrates, be it from dairy products, be it from fruits, or be it from vegetables. An important aspect to be considered in this context is the focus of our societies on healthy diets. A healthy diet emphasizes a balanced intake of various food groups, including fruits, vegetables, and whole grains. However, is a healthy diet, as commonly perceived, good for this patient, 35-year female who is disturbed by recurrent bloating with feeling of abdominal pressure and pain associated with stress and food intake? She has 3 bowel movements per week and treats that with a diet rich in dietary fibers, follows healthy nutrition and several hours of exercises per week, and has a stable BMI. And which advice shall we give her? Before we can discuss this in detail, I have to introduce you to the concept of FODMAP and the relation of FODMAP to the more commonly used terms of healthy diet or dietary fibers. FODMAP is in fact a group of poorly absorbable small and medium chain carbohydrates defined by their common chemical detection method. They do not include long chain carbohydrates, dietary fibers, for example, like pectin. This study has shown that IBS patients have a high inter-individual variability in their intake of fermentable carbohydrates, with a maximum of up to 80 grams per day. There were 2 study groups in this study. the first receiving first the baseline diet, followed by low FODMAP and rechallenged. This group 2 had 2 phases of baseline diet, followed by low FODMAP diet. And here you see the inter-individual variability in the total FODMAP intake during the baseline diet, going up to 80 grams per day. And beyond the issue of FODMAPs, lactose malabsorption has to be taken into account. Please be reminded that the high worldwide prevalence of primary lactase deficiency provides a large potential for carbohydrate intolerances, especially in these countries here, which are colored in the red shades. I do not want to go into more depth in lactose intolerance, but want to refer you to this previously recorded video presentation on this topic in WUMEDI. However, I do want to raise the issue of fructose and its dose-dependent incomplete absorption. In this analysis of 9 studies incorporating 455 breath hydrogen tests, the significant correlation between likelihood of malabsorption being detected and fructose dose is clearly demonstrated. Recently, a new issue has come up in the field of carbohydrate maldigestion, and this is the functional deficiency of human carbohydrate active enzymes, HCAC enzymes. One of these functional deficiencies are the rare hypomorphic sucrase isomaltase variants, and in this study it has been shown that in hospitalized patients with diagnosed IBS, the likelihood of one of these rare hypomorphic sucrase variants being present is 12.5%, as compared to 8% in their control groups, the asymptomatic control groups, or the self-diagnosed IBS. We return back to this study in which IBS patients with functional variations of human carbohydrate active enzymes have been demonstrated to have more IBS-related symptoms. In this study, a whole panel of functional variations of carbohydrate digestive enzymes was analyzed, and it was shown that symptoms of bowel habit dissatisfaction, life disruption, or the total IBS SSS scores were related to the enzyme carrier status being present, and to the number of affected human carbohydrate active enzymes. Let us complete this first part of the presentation and summarize the why of dietary treatment of IBS. Poorly absorbable carbohydrates are an integral component of healthy diet, with dietary fibers, with fructose and lactose, with FODMAPs. They are an important source of symptoms in IBS, and they are increasingly encountered with on a worldwide scale as the westernization of diet increases lactose exposure in many countries which have a high prevalence of lactase deficiency. Poor absorbability of carbohydrates may have its origin in physiologically incomplete absorption. This refers to dietary fibers, fructose, xylitol, sorbitol. In enzyme deficiency, which refers to lactase trihylase, and in hypofunctional variants of digestive enzymes. IBS patients as a group are very inhomogeneous regarding their intake of poorly absorbable carbohydrates like FODMAP or dietary fibers. For more information, look at www.carboception.com or follow us on our YouTube channels or Instagram channel with the name of Carboception.